So this video kind of rides on the coattails of my food video and feeding your dog, and that's talking about the medication for your dog. And most of us are going to experience some type of a health issue with our dog at some point. And most of the time it's going to be something pretty simple, like your dog has picked up some fleas on a walk, or it could be that they're in your backyard. You might live in an area where there are ticks, and that can be a real concern. So you do want to make sure that your dog is getting treatment for that. And you want to talk to your veterinarian to see what they're going to recommend for your dog. Really avoid the flea control that you can pick up at the grocery store. That's not safe. You want to talk to your veterinarian and get on something that's quality, because it is a poison, and you don't want to mess with that when you're putting it on your dog or having them eat something. So there's different types of these applications. You can do something that's topical where it just goes on their skin. You could do something oral. And the oral flea medications and the tick medications, they will often also treat for intestinal worms like roundworm, hookworm, whipworm, tapeworm. Not all types of tapeworm, but at least one type of the tapeworm. And that can be something that's good to just have your dog on a regular every month schedule, because like I was saying in my food video, it is really easy for your dog to pick up a lot of these parasites. They could just be walking along on the grass and then go and lick their paws, or they could be licking a mud puddle, or they could share a food bowl. I mean, there's just so many ways that the dogs can get these things. So we have to be really careful about that. And there's also Giardia and Coccidia, which in some cases, dogs can just pick that up in someone's backyard, because if there are rabbits that go in or squirrels that go in and they're leaving droppings, then the dog goes and eats those, even if you're not, it just looks like your dog's maybe eating grass, but they're getting something else in there, and that can make them really sick. So if your dog has loose stools, you want to start off by feeding them a bland diet. That might be just some cooked white rice for a couple of days, but if it's not going away, there's probably something underlying that's going on. And we always send our adopters with medication, just make sure their dog is starting out fresh, because they're coming from a kennel environment with a lot of other dogs. And we are never going to place the dog with someone if we see that there are health issues with the dog. We always make sure that that's taken care of first. But even when the dog looks perfectly healthy and the stools are all solid and everything looks awesome, we are still sending you with some medication just to make sure that they get started out totally clean. They've got a clean slate. And some of the medications for that might be fenbendazole, metronidazole. So we've got Albon. There's a lot of different types of medications that are out there, but you'll talk to your veterinarian about that if you start to see any problems with their stools that isn't going away with changing their food to something bland for just a couple days. And something else that you want to make sure that you're seeing your veterinarian for are your annual vaccines, all the boosters. So our dogs are all up to date on all of their vaccines and everything that we need for our areas. And we will give you the vaccine records so you know how to follow through with that. And it doesn't have to be really all that complicated. I'm not going to go over all the different vaccines that your dog is going to need. You'll be able to take the vaccine record to your veterinarian, and they're going to tell you what you need. But if it's a really young puppy, it's probably going to be, 3 weeks later, maybe even sooner than that, to get another booster vaccine. If it's an older dog, you might be going once a year. And we recommend that your dog goes to the vet every 6 months to get an exam. At the bare minimum, it would be once a year, but we really recommend every 6 months, because the doctor would be able to see if there's anything going on that needs some immediate help. They might see, this dog has chronic ear infections. Maybe you didn't even know that. Maybe this dog has fleas, or your dog has a rash. What's going on? Are you using a pesticide in your grass or weed killer that could be causing some trouble? So we recommend that you go and see your vet pretty regularly for that. A lot of dogs will also need to have a yearly dental cleaning, so you want to talk to your veterinarian about that. And let's also talk about ears. And we'll talk about this more in our grooming video, but you do want to make sure that you're cleaning your dog's ears every time that they get a bath. And with some dogs, we're going to be cleaning their ears even more frequently than that. I like to do it every week at least. And there are a lot of different ear cleaners that are available. I like to get one called Keto Flush, and it's Trisultra Keto with Keto Flush on Amazon. And it's a white bottle with some purple logo on it. You can order that and they're gonna ship it off to you, and you just, it will tell you on there how to do it, but you're gonna flush your dog's ears out and then wipe them. And that usually keeps any ear infections at bay. So that's really basically some health things to consider and taking care of your dog. Remember, work really closely with your veterinarian, and let us know if you have any questions.